Welcome to the Just Ingredients podcast. I'm Cara Lynn, and here we talk all things nourishing to the mind, body, and soul. This is a place where you can find just good ingredients to life. Dr. Jonathan Fellus is a neurologist and neurorehabilitation expert practicing in Morristown, New Jersey. As a subspecialist, Dr. Fellus focuses on patients' ability to function and can treat multiple conditions that affect the brain, nerves, and spinal cord. Dr. Fellus can diagnose and treat pain that is a result of injury, disease, or a disabling condition. Rehabilitation specialists often lead a team of physical and occupational as well as speech and cognitive therapists in a patient's treatment or preventative plan. Few neurologists in the U.S. have specialty training in this field. Dr. Jonathan Fellus also participates in the New Jersey Medical Marijuana Program. Advanced Neurocare is headed by Dr. Jonathan Fellus, who also specializes in quantitative EEG, a test used to assess the brain's function by measuring brainwave activity, and uses neurofeedback to help correct the functional abnormalities detected by QEEG. Other complementary, alternative, non-invasive, and non-medication strategies are used to improve and optimize brain function. Interventions such as nutritional supplements or Nutraceuricals and other technologies in this category of Electroceuricals are offered. Also certified in using Spravato for treatment resistance, depression, or suicidality. Welcome back to the show, everyone. Today we have Dr. Fellus here on the show with us. I'm really excited to talk to him about our brain and our mind and all the things around brain health. And so welcome to the show, Dr. Fellus.
Thank you very much, Carlin.
Will you tell my listeners just a little bit about yourself and your background?
Sure. Went on to medical school after majoring in neurobiology in university. After medical school, I still knew I wanted to focus on the brain, so I went on to a neurology residency. And then I did a subspecialty, what's called a fellowship in neurorehabilitation. So, healing brains that are broken through trauma or non-traumatic disorders, diseases. And then I led the largest brain injury rehabilitation program in the country for about 13 years. And then I've been in private practice for the last 12 to 13 years. And that's where I'm at today, is doing a private practice that really focuses on brain wellness, health, healing, disorders, disease, and integrative approach.
Well, I am excited, like I said, to talk to a neurologist about some of these integrative approaches. But let's just start maybe distinguishing the difference between the brain and the mind. Are they the same thing? Because you hear them interchanged a lot, or are they different?
Well, I think you can't have one without the other, right? The organ of the brain is, that's where we do just about everything, thinking and personality, and what makes us human. So I would say that the simplest way to think about it really is that the brain is hardware, right? It's an organ, it's a thing, it's substance, it's tissue. That's your hardwiring, let's say. And then the mind would be like the software, the soft wiring, the thing that is malleable and responds to experience and education and pleasure and pain. And it's shaped by our life experience and shaped by our ability to, change your mind, right? People say, we have the phrase, you change your mind. We try to change minds all the time, whether it's our own or someone else's, but you can't change your brain.
Okay, so I think this might be new to some people, but what is comprehensive integrative approaches for the brain? Is that something that lots of people do, or something just you do?
Well, what a simple question, Carlin. There's a one-word answer. Yes. Let me compress all of brain research and my 30-year career. No, it's great. I'm just joking. It's I would say it's been an evolution, right? Where everyone historically is dealing with one little slice or one approach to the brain, or when all you have is a hammer, everything looks like a nail, right? Surgeons know how to cut. So the paradigm, just the foundational paradigm of neurorehabilitation is really interdisciplinary. So that gives you a hint at the beginnings of kind of the approach to a holistic. Everybody knows the word holistic, right? And then you have what became, from holistic, it became complementary alternative medicine, CAM, probably 20, 30 years ago. And that's really morphed or shifted or being reimagined, reinterpreted, reinvented as integrative medicine. To integrate is to bring together all the different tools in the toolbox, again, not just your hammer, because everything's a nail, but you need, screwdrivers and saws and all the tools in the toolbox, and then customizing it. With the advance of technology now, the more we can identify or diagnose, gather data on what makes your brain different from my brain, then we can begin to really tailor different approaches that comes at the problem from all different angles or from multiple different angles, right? Because look, if the brain just did one thing, like a heart pumps blood, okay? Heart does one thing. That's why we can take it out and put in a new one, right? But we can't take out a brain and put in a new one because the brain is so ridiculous. Oh, it's the most complex thing in the universe as far as we know. And so the brain works electrically and it works chemically. Those are signaling, right, between the brain, point A to point B. Metabolically, the brain takes 20 times more energy than any other tissue in the body. And magnetically, electromagnetically, anyway, the brain is doing all these things billions of times a second, and it's super complex. So then it requires a very sophisticated, complicated approach, and that is integrative medicine. Multimodal, right? Multiple different modalities.
You did a great job explaining something very complex into very simple terms for us to understand. So thank you. Okay, you talk about these different tools in the toolbox to try to understand the brain, which I love that analogy. And one that I see on social media quite often now and is becoming more popular, I would say, is neurofeedback. And so I want to talk about that, but maybe let's just explain to the listeners, if they haven't heard about it, what exactly is neurofeedback?
So neurofeedback is this therapeutic technique that has been around for probably since the 1950s or 60s. It began with a simpler form called biofeedback, which is just feeding back information about your biological state to you so that you can understand what's going on. In a way, it's kind of like technology-assisted mindfulness, right? Because if you're aware of what's going on in your body, that's biofeedback. You're fed back information about your biology. Now, if we talk about the brain, that's where we get neurofeedback. Neurobiofeedback is too long, so we make it neurofeedback. So if we can display to you, the user of your brain, right, what is going on in your brain in a kind of understandable fashion, then you can begin to do something about it, right? Change your mind. And so the technology just keeps getting better and better, faster and faster, more and more accurate, and then AI assisted. And we can transform, let's say, brain activity, and make it sort of readable, understandable to you. And that forms the basis then of the change that we want to make happen in the brain. Now, so the first step really let's take a step back from neurofeedback, is brain mapping, or what's called quantitative electroencephalography, QEEG, or just we say the Q. And that is just like you have an EKG for the heart that measures what's your electricity in your heart. Very simple, right? Just a pump, very simple electrical. So the brain wave measuring is an EEG, electroencephalography, and then we can quantify all the different brainwave frequencies from a slow to a medium to a fast brainwave frequency. And once we can quantify all those, now we can say, okay, well, you got too much of this and too little of that. And generally it works out, most people, for whatever condition we're talking about, either have too much of an unwanted bad brainwave activity or too little of a good brainwave frequency.
Interesting. Okay, so I've heard on social media that this neurofeedback can help things like ADHD, anger issues, depression, anxiety. Is that true?
Yeah, absolutely true. We've been able to make a real difference in those things, all those different areas for many, many years. And like I said, technology just keeps getting better and better. Let's rattle off. Yeah, anxiety, depression, insomnia, ADD, autism, concussion, dementia to some degree, certain motor problems, coordination issues could benefit. Long COVID, wow, yeah, that's been just an explosive area that we've been dealing with. So anything that really reflects abnormal or unwanted human behavior or human psychology, human, mental conditions, yeah, and cognitive conditions.
So are you actually changing the brain's wavelengths to improve these conditions?
You almost got it right. We're changing the amounts of the different brainwave frequencies. A frequency is like a wavelength. So sorry to be picky, neurologists, I'm hung up on words, but we are altering the amounts and the strength of the signal because we're rewarding the brain for making the right choices in a way. So that's what this is based on. And here, you're right. We are trying to change the brain, and that is possible because, let's say, historically, right, you take a medication, you treat the symptom, but if you stop the medication, you haven't fundamentally changed the underlying, right? That's the holy grail. That's what everybody wants. Everybody says, well, I want to fix the problem. Well, here's an opportunity to really, truly fix the problem because we are rewiring, reorganizing the circuitry, the connectivity of the brain. The functional connectivity of the brain can be altered through this reward paradigm, which is called operant conditioning. Most people have heard of Pavlovian conditioning, right? That's a type of conditioning, but operant conditioning means this was, B.F. Skinner in the, 60s or so, and he said, well, and this is how we all work. We all work on reward, right? If you go to work and you get paid, you're going to go to work again next week. If you went to work and didn't get paid, you wouldn't go back there. So reward and punishment here, we're just talking about withholding a reward. So what we do is we say, look, this is the target we want. There's not enough, let's say, there's not enough alpha brainwave frequency. Now, if we can get your brain to increase it by, let's say, 10% or 15%, we're going to give you a reward. And then your brain is going to say, aha, I just got rewarded for going in that direction. Let me do that again. Anything that we get rewarded for, the brain is more likely to do it more and more and more. Anything we get punished for, and this is how we train a dog, this is how we train children, and this is how we train ourselves.
Okay, so if we're training the brain to change the frequency, it sounds like this is not just a one-time deal.
Is anything that easy, Carlin? Is there anything?
We wish.
I mean, if you're hungry and you eat, that's a one-time thing. Antibiotics for pneumonia, there's not much that's just a one-off in the brain, We're talking about shaping and changing and altering brain pathways, connectivity, functionality, functional connectivity, and that takes time. But, historically, you could go to therapy for 10 or 15 years, right? You could sit in a therapist chair, cognitive behavioral therapy, right, CBT. You could meditate, you could become a meditative, yogi, 20, 30 years. But now with technology, we're able to accelerate this, and maybe what took 30 years now may take 3 months.
Interesting.
Historically, even until the technology got better to where now we're able to put it in your home. Before you had to come to the office, you had to sit there for 45 minutes, you have to travel to and from the office. Kids can't get there after school to work on their ADD. Maybe they get there once or twice, and it's costing you out of pocket $100, $150, $175 a session. Now, by putting it in the home with this self-contained system that we've put together with, the hardware and the software and the app and the ability to monitor things remotely, now you're able to do unlimited sessions, shorter sessions. It's like higher reps at the gym, right? You could lift 500 pounds once, or you could do 50 reps, of 10 pounds, and that's a lot easier on your muscles, and you'll get better faster. So that's been the real breakthrough here, I think, is the ability to miniaturize in a way, again, technology, shrink it down, put it in the home, and then you can do it more frequently. You have better compliance, right? Compliance is the key to therapy, any therapy. If you don't do it, it doesn't work. So there you have it.
Okay, I do have a question about this, though, because there is a clinic near me that does neurofeedback, and a friend of mine wanted to take her son there for his ADHD. But her biggest concern was that this might change his sweet personality. But neurofeedback does not affect the personality, correct?
Well, I mean, unless we're trying to change something that we don't like about the personality, that's bad, that's unwanted, it doesn't just do it. People think, well, first of all, let's talk about the fundamentals. You're putting on a health, right? So I talked about the diagnostic piece is the quantitative EEG, or just brain mapping, the Q. And then that informs, okay, what are we going to do therapeutically? We're going to choose this to go after therapeutically. You're wearing a cap with electrodes. And by the way, there's an advance there too, where the electrodes used to be wet. We used to have to inject gel. Now we have a dry cap system. These are dry electrodes. So your hair, we used to have people come out of gel and they had to clean their hair and everything. Now that's it. There's no muss, no fuss. These electrodes have gotten better. They're more sophisticated. The algorithms have gotten better. We can use fewer electrodes. And people think, oh, is this giving some sort of electricity in my brain? No, it's reading your brain electricity, and it's rewarding you for making the change on your own.
Okay, that's good to know. So it will not affect kids' sweet personality or tenderness or things like that.
Absolutely not. We are not looking to zap or neutralize any of the fundamental good things. You can't. You really can't. That's so fundamental. We're just trying to help them get rid of the unwanted, intrusive, uncontrollable stuff.
Well, I've heard amazing things about neurofeedback from many people, and so I'm glad I asked you those questions, and it's a great thing for people to know about if they have kids that are struggling with different issues, or if they're struggling with issues, it's a great thing to know about. So thank you for explaining that. And I love that it's one tool in your toolbox, and I know that you use a lot of other tools in your toolbox, like nootropics or medicinal mushrooms, vitamins. How do these components work to support the brain, or what are some of the things that you use frequently?
Sure. So, look, foundationally, historically, pharmaceuticals, right? Drugs. I'm still, when the time is right, you got to pull those out, and they're quick, and they can help accelerate improvement by using whatever medication it is, depression, anxiety, ADD medications. These can help sort of bring the temperature down to a more manageable degree while we employ and get into place these other kinder, gentler, more sustainable techniques, such as neurofeedback, which is a form of non-invasive neuromodulation, right? It's not invasive, it's not surgery, it's not an electrode, it's not, we're not cracking a skull here. So it's non-invasive, it's neuromodulation, it's a regulation, it's a modulating, it's a tweaking, it's a fine-tuning. It's so that's what we would call an electroceutical. I wish I'd come up with that word, right? So we have pharmaceutical is the drug, electroceutical is the non-invasive neuromodulation technique, typically neurofeedback. There are other forms. And then in the middle is, good old-fashioned nutraceuticals or nootropics. Nootropics is one form of nutraceutical. These are, medicinal substances that are derived from nature, botanicals, herbals, that sort of thing, roots, right? So knowing what the brain is in need of, knowing that, the most fundamental basic thing is minerals and vitamins. Yeah, those are just basic, obvious. Omega-3, sure, you want to make sure that all those things. But then, that's just the raw material, basic fuel for the brain. And there's supercharged fuel too, right? There's things that you want to fuel your mitochondria. And I know you've had plenty of guests talk about mitochondria and energy and energetics, metabolism. That's crucial, absolutely crucial for the brain, because nothing happens in any cell without energy, ATP from the mitochondria, fundamental unit of energy. But especially in the brain, boy, just to maintain the brain at baseline, homeostasis, right? Homeostasis, just keeping house, homeo, right? just keeping house in the brain requires an enormous amount of energy. I remember when I was studying in medical school, after a while, I was like, I'm eating 5-6 meals a day, and I'm not gaining weight. And I'm sitting there studying. I'm like, wow, I am burning some serious energy just, expanding my mind. So nutraceuticals are important. And there we have things like adaptogens, which I know you've certainly talked about with your other guests. Adaptogens are really important. I call them like shock absorbers for the stress of life, or the chemical stress that's going on. We all know about oxidative stress, right? Which is basically like rust. So oxidation, we want antioxidants, right? We want to calm down that oxidative stress on the brain. And then we want to reduce inflammation. So anti-inflammatories, right? Because we know that the American diet, where there's sugar lurking in every which way, they keep changing the name of sugar over and over so that we won't, figure it out. That's the number one source of inflammation, right? So we want an anti-inflammatory approach. We want antioxidants, and then we want adaptogens. And then there's other, forms of nutraceuticals that we would give, whether it's energetics, aimed at improving energetics, or raw material like the amino acids that are the precursors to certain neurotransmitters. So that's a big overview.
Okay, so I know my listeners might be thinking, well, how do I know if my brain needs certain vitamins, or how do I know which adaptogens to take? And so do people do blood work to test like their vitamins and minerals for what their brain needs? What adaptogens do they know to take?
Yeah, there's a little bit of that. There's some certainly ways that we can measure inflammation. There are inflammatory markers that we can determine in the blood. We can certainly measure things like, vitamin D. Everybody knows that everyone's vitamin D is, pretty much low. Mine was, low 30s. So I'm taking the vitamin D supplement. It's very hard to get enough vitamin D from the sun anymore, right? Because we're not supposed to be in the sun to avoid cancer and So, but you also want to make sure that it's not just normal. You want to make sure it's optimized, right? There's normal and there's optimal. And so much of optimizing, the brain brain function is about optimizing the substances that keep the brain running. So it's not enough to just have a normal value of certain things. You want to make sure it's, there in the optimal range. So there are some blood tests, but there's not blood tests for everything. We have to infer certain things just based on our knowledge. Like, someone with long COVID, maybe we don't know yet what markers. It's so new, we don't know what markers to measure yet. That's a reliable marker. I'll give you one cool example, though. There's this, we've all heard in Alzheimer's, there's plaques. And most people have heard about plaques in Alzheimer's, but fewer people have heard about tangles. There's something called neurofibrillary tangles, these clumps of abnormal protein. And that's another way that gums up the work and causes brain cells to malfunction. And so we see plaques, mainly in Alzheimer's. We see tangles. We see tangles in Parkinson's and what Robin Williams had, Lewy body dementia. And we see it, Bruce Willis has got, progressive primary aphasia. We see tangles there too. And we see it with the football players, chronic traumatic encephalopathy, this abnormal collection of what's called p-tau, or phosphorylated tau. Tau, up until like 6 or 8 months ago, the only way you could measure that was in spinal fluid. You'd have to take a spinal tap and measure in spinal fluid. Well, now we can measure it in the blood. So I've been measuring p-tau in the blood and say, okay, well, here's a marker that the brain is stressed, it's struggling, it's shedding this abnormal protein. And then I can approach that with something, say, like methylene blue that, probably some of your listeners are familiar with. So again, all the tools in the toolbox to come at it, because the brain isn't just malfunctioning in one little narrow sphere. Brain trauma is going to cause problems with inflammation and stress, oxidative stress, and it's lacking in certain chemicals and fuel, and it's requiring a lot more fuel just to put things back in place again. So if we don't come at the brain from these multiple angles, then we're doomed to failure. And that's trillions of dollars of research that, that's how I came really to this. Is I was taking care of all these train wrecks, and they eventually sent me the worst cases from Iran and Iraq of brain injuries. I mean, horrible, horrible cases. I dealt a lot with coma and vegetative and even brain death patients. And I had to look around, and I said, there's not a single drug that's approved. There's not a single drug that's FDA approved. And I already saw the writing on the wall. Trillions of dollars had been spent going after a treatment for Alzheimer's. And the problem there, Carolyn, is that the scientific method says, let's just change one variable at a time.
Right.
That ain't going to cut it. That has led to absolutely zero treatments, let's say, for concussion and brain trauma. Okay? Zero. So I had to look around and say, well, I got to beg, borrow, and steal from all these other kids. I know what's going on in the brain, and I see these other, tools in my toolbox, whether it's medication or it's natural substances, right? Nothing stays around for 2,000 years as far as humans are concerned, and it doesn't work. If something works, we pass it down from generation to generation, right? We're not taking ashwagandha after 2,000 years because maybe it works. It works, right? We're human beings. We find cocaine, we find sugar, we find cannabis, alcohol. We find these things. They work. Well, we pass it along to our to our offspring and say, hey, this thing works. So anything that's been around for a couple thousand years, yeah, it works.
Yeah. So I'm curious, since you mentioned ashwagandha, is that your favorite adaptogen for the brain, or you have a few different favorites?
It's my favorite, I would say, because it's the one that gets most at anxiety, and anxiety is the most common problem out there. I mean, gee whiz. Look, anxiety. Without anxiety, we wouldn't do anything. We are bred as human beings. We have evolved to have a pretty high level of anxiety. Without anxiety, we wouldn't get up in the morning. We wouldn't do anything. We wouldn't build a house. We wouldn't go and get food. We wouldn't go to work. We wouldn't take care of things. You need anxiety. The problem is in our society today, right? Anxiety is in overdrive. Early on, what was one of the major symptoms we saw from long COVID? Anxiety. It was incredible. Anxiety, depression, insomnia. So I would say because problems of anxiety are so ubiquitous, ashwagandha is generally number one, yeah.
Okay, that's good to know.
I certainly have other adaptogens that I turn to. Like yours, your brain support has, Bacopa Monieri, or Brahmi, right? Brahmi is a high priest. A Brahmin is a priest, right? It's the high priest of adaptogens, Brahmi, Bacopa.
Well, I love that you have a variety of tools in the toolbox, and those adaptogens you said are amazing because, like you said earlier, they are shock absorbers for all the stress that we are dealing with. And you touched upon anxiety, but I do want to talk to you in more detail about mental health because I talk about depression a lot. I dealt with depression. And so how does our brain affect our mental health, whether that's depression or anxiety?
Well, it's everything. I mean, that's where anxiety and depression live, right? So if your brain is not healthy, if your house is a mess, your family doesn't function efficiently, right? You got to keep house, you got to keep things clean and organized and well-oiled, and you got to keep the lights on and the electricity, right? Your family is not going to thrive if they're living in a house of chaos and disrepair and pollution and, brain fog, right? All these things contribute to brain fog, which is means a million different things to a million different people. So mental health absolutely is foundational. It's predicated on good, clean living, right? It's just what your mother said, eat right, sleep right, reduce your stress to a minimum, and have, good social connections and relationships. We're social beings. We need to be social. We need to have love and passion in our lives, but we also really need to sleep right, eat right, reduce stress. So that's the whole, holistic approach to mental health and well-being. That much we know.
Okay, so I want to ask you this because when I dealt with mental health and went to the doctors, and granted, it's been 17 years now, but back then they would say, there's nothing you can do to heal from depression. We can give you the antidepressant and that's all that we know. And so do you think 17 years later, neurologists and therapists and, all of them are understanding those holistic approaches that you just stated, that nutrients and the food we eat and our stress and our sleep all play a key role in it?
It's beginning, the trickle-down effect is beginning to drop, dribbles and drips and drops of this breakthrough, recognition, realization. It's starting to hit the broader base of doctors, brain doctors. It doesn't mean they know what to do about it. They themselves individually, because they're not trained or they're not inclined or they're not bold or they think they're not going to get reimbursed, or it's, the eye can't see what the mind doesn't know. The eye cannot see what the mind doesn't know. So they're just at a stage where their mind is beginning to know, and then they're beginning to see, and then they still don't really have the tools of what to do, or they're not oriented to that. They didn't go to school for that, right? They're not curious enough to explore. Thankfully, I was curious enough to push the boundaries and be aggressive and creative, and that's my nature, and I'm blessed, totally blessed that my passion and my skills, match my job that, I've chosen. I'm absolutely blessed. Your question was, are they beginning? Yeah, let me give you an example. In 2016, revolutionary, this is a turnaround of the heresy that says there's nothing we can do about dementia. Let's take dementia in place of depression, because we all can agree that, dementia was just seen as, well, there's nothing you can do. It's like a cancer of the mind, right? Forget it. You got dementia, you're done, you're finished. As of 2016, they began to really say, no, 40% of dementia is preventable. 40% of dementia is preventable. I can go through, whatever, the 8 or the 10 different risk factors or modifiable risk factors that they, came out with. And since then, they've added a couple more, and they just came out with 2 more, and they now upped it to 50 to 60% of dementia is considered to be preventive.
Wow.
That's heresy. That was never, ever. So, the example is then that neurologists are starting to hear that. They're starting to understand that. Again, they still don't, most of them, the vast majority of them don't have the tools or the inclination to do something about it, but at least they're starting to have a conversation.
Let's take a quick break to hear from our show sponsor. You know about the Just Ingredients podcast, but did you know I also have an entire product line? One of our best sellers is the Just Ingredients Probiotic Complex, a unique 3-in-1 blend of prebiotics, probiotics, and postbiotics. Probiotics replenish the beneficial bacteria in your gut. Prebiotics are fibers that feed those good bacteria. Postbiotics are the powerful byproducts that help heal the gut lining, support hormone balance, and boost immune function. The probiotic complex comes in 2 delicious flavors, lemon ginger, which tastes like fresh lemonade with a tiny hint of ginger, and elderberry lemonade, which many say tastes just like grape juice. You can't go wrong with either. This is a product you can feel working. Customers often share stories of reduced bloating, more regular bowel movements, smoother digestion, clearer skin, and even weight loss. Since the gut is foundational to overall health, supporting and healing it can improve many aspects of well-being. As a special offer for podcast listeners, you can receive 15% off the probiotic complex with the code JIPodcast. Find better gut health at justingredients.us. Now back to the show. Okay, well, let's actually talk about dementia. We'll come back to mental health, but since we're talking about dementia, because I was just talking to someone yesterday about dementia and what the risk factors are, but what are some of these things that we can do to help prevent dementia?
There's this great diagram. If you just type in, diagram, preventable, dementia, and it's mainly from the journal called the Lancet Neurology, Lancet, Lancet Neurology. And it's got this great diagram because it goes like from early in life through middle life and then to later in life. So what are the things? Let me give you some pointers to your listeners. Some education. Education is one of the earliest things. The higher degree of education, the more you expand and build your mind, the more extra activity you have going on, the deeper your bench, right? You can afford to lose a little bit more before you slip into dementia. protecting your brain from concussions, brain injury, traumatic brain injury? Absolutely. Every time, you get a serious blow to the brain that constitutes a mild traumatic brain injury, or what used to be called a concussion, you're losing brain cells. Hearing, preserving your hearing and your vision. These are the sensory inputs, right? This is what goes into the brain to tell you what's going on in the outside world. 8% of dementia is preventable by preventing hearing loss. 8%. That's like the number one. Yeah. Social isolation. What's the latest epidemic we're dealing with? Loneliness. Even before COVID, we were headed towards an epidemic of loneliness. Young kids having less and less sex. I mean, wow, right? The statistic is unbelievable. Who would have ever thought that, young adults, young kids would be having less and less sex? If that's not indicative of an epidemic of loneliness, what is? And not to mention, of course, the elderly and all that. Of course, we know that, right?
Right.
Historically. So social isolation. We're social beings, right? You have this resurgence of Stoicism as this great philosophy. That's been all the rage lately. What's that based on? We're social beings. We have to interact with each other. And we saw the effect of COVID, fraying of our social supports and networks and connectivity. So those are a few. Pollution, don't live by a highway. Don't live in a downtown. Pollution is a contributing factor. Those are some of the ones. Of course, smoking, don't smoke. Of course, excessive alcohol, we know that. Control your cholesterol, control your sugar. These are fundamental, foundational things, right? Sleep deprivation, insomnia. Again, we're back to good, clean living. Eat right, sleep right, reduce your stress. Stress has actually been found. We used to think that if you lived in a downtown, ghetto, whatever, inner city, that maybe you had less education, so there were higher levels of dementia. No, what we discovered is if we put rats in a kind of a similar, inner city situation, it's the stress. It's the gunshots that you're hearing. It's the fear of getting stabbed. It's the poverty. Sure, poverty, stress. But that's not, the poverty alone is not just making your brain less healthy. It's the stress, that chronic cortisol. I was listening to one of your previous, on hormones and adrenal insufficiency and everything. Yeah, stress. We're not meant to be stressed, 24/7. We're meant to have little bursts of stress, but stress is absolutely corrosive to the memory centers in your brain.
Okay, so I'm curious because you hear a lot of people talk about dementia or Alzheimer's as type 3 diabetes. So do you agree with that?
Yes. I think it's helpful to characterize it that way, for some percentage of the population. It's helpful for them to understand. I think if nothing else, it really emphasizes this pivotal role of sugar and inflammation. So diabetes, okay, we understand diabetes is connected to sugar. And then we think of sugar for the next level of people. I understand, oh yeah, sugar, I've heard that's inflammatory. I think it helps to characterize it that way. I'm pretty sure it was Dr. Bredesen, a neurologist out in California, who wrote this pivotal book in 2017, The End of Alzheimer's. Again, that would have been considered heresy. But he talks about, having 42 holes in your roof, and these are the 42 holes. If you can plug 10, 15, 20 of them, you'll be doing great. You'll preserve your house from deterioration when the storms come. And so he's been one of the people who's popularized thinking about dementia as type 3 diabetes. But inflammation, sugar. It's like, location. It's inflammation.
If someone's listening that has a family member maybe dealing with dementia or one of these, is it too late to do anything to help them? Or can things like lowering the inflammation or lowering the blood glucose levels, can those things maybe somewhat help?
100%. Absolutely. There is absolute. Look, you're always going to have extreme cases, right, where the brain is just programmed and it just goes, rapidly downhill. Now, it's like, cancer. That's like saying, oh, if you have a diagnosis of cancer, is there anything to do? Yeah, there's a lot to do, right, for a lot of different types. Now, we know that no matter what you do for certain cancers, there's just no chance, right? That's it. You could do everything and you haven't changed. But there's a wide spectrum, right? There is a wide spectrum. So, yeah, there's plenty you can do because, you may not be changing the brain, but you're changing the function, the mind, the connectivity, the software. Again, you can't just pull out a piece of hardware and plug in a different piece of hardware, but you can alter the way that the brain is functioning and communicating and running. And because, think of inflammation as like not just fog, but smog, right? Fog is at least a natural, weather phenomenon, right? I can't see from here to there. The fog is in the way. Smog is like pollution inside of the fog. And if you reduce the pollution and start to clear up some of that fog, you're going to be able to see a lot farther. And that means your brain is going to be functioning. It's going to, communicate from point A to point B a whole lot better. It's going to have better memory. And so absolutely, there's ways to slow the process, and in some cases, even reverse.
Okay, that's good to know. So I'm curious, though, with this inflammation, because we didn't finish talking about anxiety and depression. And so I'm curious, with long COVID, with the long haulers, you said, a lot of them have anxiety afterwards and brain fog, things like that. Is it due to the inflammation from COVID or something else?
So we're still not sure. The more and more that they're doing, studies and autopsies, they are finding certain types of inflammation that you can't just see on an MRI or an EEG. You can't just see on these tests. You really have to get tissue. But early on we thought, inflammatory storm, that's what killed the lungs, and that's how people died. This massive inflammatory reaction in the body, and that's how people died during COVID. Okay, so we really thought, there's got to be something going on. Like, what would cause long COVID to cut across all these different, organs, digestive problems and heart and lung problems, and yet brain problems, all these different areas, but we can't see it. Like, how does that happen? Well, I think it's really, I'm not the only one. I didn't discover this. I think it's really mitochondria, right? If you don't have an engine in every single cell that governs every single function in the body, well, then you're not operating at capacity. So I think it is a lot to do with damage to the mitochondria, and whether there's fewer mitochondria or they're damaged or they're not working properly somehow. But yeah, there's a psychiatric diet, there's a mental health diet that says basically it's Mediterranean diet, right? I mean, it's the Mediterranean diet, anti-inflammatory, right? And what's funny, Carlin, is the Mediterranean diet is not, we can't just import the Mediterranean diet and just eat the Mediterranean diet and get all the benefits of the Mediterranean diet. Back to the socialization thing, it's like a meta concept above meta. So there's Mediterranean, there's meta, you have to eat a meal together, right? The Mediterranean diet, okay, you can't sit around for 2 hours like the, Italians or the Greeks, 2 hours lunch, that's not practical. But it shouldn't be 2 minutes. It shouldn't be 2 minutes on your own in a closet, while you're at work. It's got to be something, so sharing food and interacting with people. Again, you can't just pluck something out of its milieu, out of its origin, and drop it, and plug it into or this over here and think you're going to get all the benefits. Sorry, I think I've gotten a little, anxiety, depression, inflammation. I mean, it really all, comes back around diet, anti-inflammatory. And if you can't achieve that on your own, there's, supplements to do that.
Yeah, I like that you're mentioning all of them, because it's like saying you can't just sit and eat a Mediterranean diet and ignore the socialization and your lifestyle factors and your sleep and other things like that. You've got to, use all the tools in the toolbox to help your brain stay healthy. And so, okay, talking about mental health, though, let's move to OCD, because I'm curious about OCD. I have some close relatives that deal with OCD. And so is this something that is brain related? Is it something that the neurofeedback or nootropics can help? What exactly is going on?
Absolutely. Look, OCD is a form of anxiety. It's really, it's solidly in that realm of anxiety. It is an anxiety disorder, right? Ruminations over and over, you're caught in a vicious cycle, your thoughts going, and then you're activating, mind, brain body connection. Your brain sends messages to your body, and then your heart rate, goes, you palpitations, and then your brain reads that palpitations as, oh my God, we're on the fritz, we're anxiety, we got to, worry about what's going on. So that's like OCD. It's just this vicious you got circuits in your brain that are just, caught. And the goal is to really break up those circuits and to re-educate, re-entrain brainwave pathways back to more normal ways of thinking. So yes, neurofeedback absolutely can help. Supplements are important to bring down that level of inflammation that's, gumming up the works. But I'll tell you, we can almost transition here to talk also about psychedelic medicine. So, I think a lot of your listeners have heard of ketamine, certainly Spravato. I treat, treatment-resistant depression, which, comes with it is PTSD and OCD. And, it's rare that you're just treating depression in isolation. Depression and anxiety almost always are linked tightly. If someone has anxiety, odds are they have a certain amount of OCD. And so ketamine, nasal ketamine is a great, powerful tool. That's an example of how you take a powerful pharmaceutical, you bring it down from a DEFCON 10 to a DEFCON, 5 or 4, and now you can work with that more. Now you can begin to bring in those other tools like neurofeedback. We're kind of pioneering the combination of ketamine or psychedelic therapy plus neurofeedback. I would say those are the two most potent ways to access neuroplasticity. Let's come back. I know I'm not completely introducing that term to you or your listeners, but it has been a buzzword for the last few years. Neuroplasticity, right? The malleability of the brain, really the mind, I should say, right? The ability to reshape and re-educate the mind, rewire the mind. And so how do you break up the brain from these circuits of like OCD? They're maladaptive, right? They're not helping you. They're not adaptive. That's where you need an adaptogen, right? They're maladaptive circuits. You're caught in a vicious cycle. You don't know your way out. And so to break up that cycle is things like ketamine or psilocybin, right? Magic mushrooms. These are the techniques, or in severe, right, heroic cases, ibogaine, DMT, these sorts of journeys or full journeys on psilocybin. That is the first step to begin to break up the entrenched pathways and circuits and maladaptive connectivity patterns in the brain. Now, once you break that up, now you've given the brain a chance to reorganize and reconnect in more adaptive ways. And how do we shape that, right? Well, that's where neurofeedback comes in, right? So that combination, that 1-2 punch of neuroplasticity is super potent. And I think just in the last couple of years, I've really seen remarkable gains in people who, we had thrown everything at them. And again, that's a reminder, don't just throw one thing at a time. There is synergy in coming at something as complex as the brain from a multimodal approach, different modes, modalities. If you come at the brain from multiple modalities, maybe you can do a little bit less of all those things, but the synergistic effect is not just 1 + 1 = 2. It's 1 + 1 = 5, right? Or 2 + 2 = 7. You're getting this synergistic effect.
Okay, can I talk to you about neuroplasticity just for a second? Can we simplify it like this? This is what I heard someone say. So our neurons they were saying, like, let's pretend your brain is full of rivers or streams of water, right? And if you come across an event that might cause you anger, your mind just knows to go down like this one river. It's going to act in this one river. The neurons are going to go down this one river. And same with like anxiety. It's always going to go down this one stream. These neurons just know how to go down that.
The term there is the path of least resistance, right?
Okay.
The path of least resistance.
So they were saying we need to change those streams and give the streams another like curve or another turn, another exit. So when you're talking about neuroplasticity, is that just that we're changing the shape of these rivers so that when we approach something that might cause us anxiety, we no longer feel so anxious because we've changed that pathway? Yep.
It's still a piece of plastic, but we've reoriented it, we reshaped it. It's like a balloon animal. Like, hey, look at this. I got a dog. Hey, look at this. You're just reshaping, remodeling, modulating, reorganizing, redirecting, reorienting. We could use all the re-entrainment back to a more adaptive way. You have train tracks. You could say train tracks. You could say you're on a road to work. All of a sudden that bridge goes out. Oh, geez, I don't know how to get to work anymore. I got GPS. I got a GPS. All right, day 2, day 3. Okay, I don't need the GPS so much. Now I know how to get to work. I'm working around it. I'm getting around it because the bridge is out. Well, but it's still inefficient to get to work that way. But nobody tells you when that bridge has been repaired. Now I forget how to get to that bridge. I don't remember. Well, neurofeedback helps you find the path, re-entrain the brainwave pathways into the more normal, functional, adaptive, efficient pathways, or the river. Instead of the river going, all different ways, we can get the river pathway that's healthy and make it efficient and more direct. All of these analogies work.
And so it sounds amazing, and ketamine helps do that. But then why does ketamine get such a bad rap as well?
Well, look, Matthew Perry was not only getting off-label IV ketamine, but then he was abusing it at home. He was getting it from multiple sources and getting mega doses. You can ask me what's the bad rap. Look, it's a very controlled substance. It has the potential to be used as a drug of abuse, but in a controlled therapeutic setting, it is probably the most powerful drug I've seen in my career. It can, and evidence of that is that it's approved to treat suicidal ideation, right? Suicidality. That's one of the approved uses. The other is treatment-resistant depression, which just means, you've failed more than 2 or 3 different antidepressants. But, psilocybin is also very potent, works roughly on the same chemical system. I'm not necessarily advocating, it's coming down the road. It will be approved at some point, psilocybin. But I think microdosing of psilocybin has been very exciting. Again, technically, I can't tell a patient to do that because it's not legal. But if they want to have a conversation about it and how it works, and if they want to talk to someone who can talk to them about it in more detail and even maybe help them, pursue that as a treatment, then I'm all for connecting people to different treatment options. And again, look, the Silicon Valley guys have been taking microdosing of psilocybin to do what? To make them more creative. Creativity. What's creativity? Connectivity. Different ways of thinking, right? Problem solving. Microdosing of psilocybin is a way to gradually release you from the bonds of your maladaptive, entrenched, vicious cycle ways of thinking, that you think the same way over and over about things and you're stuck in that way of thinking, and gradually, bring in those connections so that they're more plastic, and then reorganizing your connections in a different way. So again, neuroplasticity is the holy grail of brain healing.
Well, and it comes down to too much of a good thing is not better. Okay, so I love that we have talked about all these different tools in the toolbox, but one thing, and maybe this should be our last thing that I ask you about, is brain injuries can play a role in mental health and your brain health. And so, that is a huge topic, so maybe we'll just briefly touch upon this. But if people are dealing with brain injuries, is this more common than people realize? Are people dealing with brain injuries that maybe don't even know they've dealt with a brain injury? What's the best thing to deal with brain injuries with?
So yeah, you're right. It's a big topic, and I've spent my whole career on brain injury rehabilitation. There's traumatic brain injury, which is like concussion and car accident, sports injuries, and assault. And then there's non-traumatic brain injury, which is like stroke or near drowning, lack of oxygen, or other toxic metabolic derangement exposures of the brain. So we have traumatic and non-traumatic. Together, they're considered acquired brain injury, and that just distinguishes it from, let's say, an inborn, congenital, brain disorder. Okay, so that's the quick overview of the structure, the hierarchy or the organization, field. And so, what to do about traumatic brain injury? Number one, avoid it. Number two, it is epidemic. It's absolutely epidemic, particularly among young males. Age 18 to 25 is the biggest demographic. That's because young males are impulsive and aggressive and stupid. And the second, though, it's epidemic, is among the elderly and falling in the elderly, hitting their heads, absolutely. So brain injury. So number one is, you want your brain to be in the healthiest possible shape so that, one impact doesn't set you back tenfold, but maybe it only sets you back, one notch instead of 10 notches. And that's if you going into it with a healthy brain with, good sleep and nutrition and reduced stress and everything like that. Or you're taking a supplement, which, the one I developed, I really saw it as, well, what if a person was walking around, nobody can walk around life with a helmet, right? But that is one thing you should do, is definitely, if you're doing anything dangerous, wear a helmet, right? Wear a helmet. It doesn't look stupid, it looks smart. But what if you could walk around with an internal helmet that protects your brain from the inside out? From the inside out. What if you were taking a supplement on a daily, your daily brain vitamin, and it could be that shock absorber, literally a shock absorber, right? When the forces of brain injury happen, it'll mute that, it'll mitigate that, it'll suppress the full degree of that. So that's where I came to it, from not just treating things after happen, but what if you could actually soften the blow, literally, figuratively soften the blow. So that's, brain injury. What can you do was your question. What can you do about it once it happens? There's a lot. The textbook says, by a year and a half, 2 years, all the brain healing is done. Not true. I've been seeing people 20, 25, 30 years after their injury, and still were able to make a difference. And I'll tell you, one of the biggest things in some of these severe cases, when I had nothing left, and along comes microdosing of psilocybin, I said, hey, I think you should explore this. I can't be the one I can't, hand it to you in a medical office. That's not legal. But I think you should pursue this. And wow, Carlin, I mean, I've just seen things happen. And then we started layering on the neurofeedback and combining the two. And we're just seeing, tremendous advances where we hadn't seen anything. We haven't seen patients do anything like this. I mean, it's really dramatic.
Interesting. Well, I'm fascinated, though, by your supplement that you created that you're saying is this internal helmet. Can you tell us just the name of it and maybe where people can get it or who should take it?
So we developed Neurella back in 2016 and started selling around 2017. By the way, which was right around when Dr. Bredesen's book, The End of Alzheimer's, came out. We didn't know what his book, but if you look up his chart on how to prevent and even reverse Alzheimer's, you'll see that he lists up to 20 different supplements. And all of the ingredients that we put in Neurella before knowing about his research are all in his list of 12 ingredients. Look, these ingredients, you can cluster them roughly as antioxidants, anti-inflammatories, adaptogens, vitamins, and raw material. And then also, I guess the next one would be boosting neurotransmitters, right? Chemicals in the brain that signal, that help with, say, memory or attention or concentration, right? So I think if you have the 12 ingredients and each of them is multifunctional, right? So one supplement is doing 3 things, 4 things, 5, potentially 6 things, right? Turmeric and curcumin, it's not just an antioxidant, right? It has these other properties. Ashwagandha is not just an adaptogen, has other properties. Rhodiola, bacopa, citicoline, which I think you have bacopa and choline in your brain support. Methyl B12, we know that methyl B12 is more, right? N-acetylcysteine, antioxidant, NAC. Resveratrol from red wine. You shouldn't drink the red wine, or you can from time to time, but you don't want all that alcohol. So you want the good stuff, the resveratrol. You can't drink green tea like an Asian. You're not going to drink 4 cups of green tea a day. But if you get that EGCG, that antioxidant, that catechin, then you're in good shape there too. Again, you're protecting the brain from the inside out for whatever will come, because an accident is unexpected.
And so, like you just said, this is not for those that are only dealing with brain issues at this moment. It is more of a preventative, protective measure as well.
Both. If someone comes to me with a recent concussion, I was like, I really think you should take this for 2 to 3 months. And then, at a full dose. then if you want to cut back after that and see how it goes. But I think your brain is in this critical period of healing and reorganizing, and it needs all the tools, all the microscopic tools to heal maximally, to heal optimally, to make the greatest functional recovery potentially possible.
So it's something that a healthy person could take every day for the rest of their lives.
I do. I take, the full dose is 4 capsules a day. I take 2 or 3 a day. But if I know I'm headed into a challenging day or a stressful day, or maybe I didn't get a great day of sleep and I've got to be on my game and I don't want to run out of steam, or I don't want to get irritable at a little thing that pushes me a little bit too far, I'll say, hey, I'm going to take 4, or I may take 2 in the morning and I get to the office and I'm like, oh, hell of a day. Let me take 2 more. So absolutely, it is for healthy and it's preventive. And I don't know that, God forbid, I'm going to get in a car accident. So I'm going to take precautions, right? Most people protect their house and their car more than they protect their brain. Most people put more energy into their lawn, into lawn care, than they do into brain care, right?
Or health care.
You put on knee pads, you put on elbow pads, you put on your shoulder, whatever. But how? What if we could put on a helmet that didn't, look like a helmet from the outside?
You're spot on. But I know listeners are going to ask 2 things. 1, can kids have it? And 2, where can I go buy this?
So I think kids, I don't want to push it too far. I would say, teens. I would say teens that are, young adults. I would say, at a lower dose. Yeah, I would feel comfortable around 13, 14, 16. And by the way, we did do a couple studies so far, one in mild cognitive impairment, right, which is the precursor to dementia. 10 patients, 30 days before, 30 to 40% improvement on multiple different, it was third party. It wasn't fully double-blinded, but we did see measures, improved mood, improved cognition across multiple different measures, improved brainwave frequencies too. So I would say, kids, again, 13, 14, 16, I'd be super comfortable age 15, 16 and above. What was your other question?
Where they can buy it.
Oh, yeah. Well, www.neurella.com, Neurella, Neurella. I thought of it as almost an umbrella for the brain. Really? It protects you from the ravages of, bad weather, right? Hail and rain and sun and all these things that just take a toll on you. So like an umbrella for the brain, Neurella. My daughter is also Ella, so maybe that was in there somewhere.
I love that.
That's where you can buy it. I think it's on Amazon. I know we were on Amazon, and then Amazon is challenging. So I think we're back on Amazon. And then through our website also is, advneurocare.com. ADV, it stands for advanced, neurocare.com. But really it's neurella.com. Yeah.
Okay, good to know. So you have taught us so much today. I appreciate you taking the time. You are super busy. But if people want to learn more from you, is that website the best place to go check out more?
Yeah, advneurocare.com. Also, New Fidelity is the name of our neurofeedback company, NEU Fidelity, newfidelity.com. That's where we, provide the in-home neurofeedback systems at a fraction of the cost of, what it would have cost you to come into, your friends taking ADD to the outpatient clinic. It's unlimited. You can do unlimited sessions, and we can program protocols during the day for your ADD or anxiety, and we can program a separate protocol as a digital sleeping pill. Think of it as digital neuromodulation or digital neuromeditation. Neuromeditation. And again, it's a way of accelerating what would have taken you, 30 years to achieve, or, so New Fidelity, Advanced Neurocare, 973-404-0407, but that's on the website, 404-0407. I do see patients across the country and telemedicine and that sort of thing.
So good to know. And that device at home, that is incredible. I actually didn't know that you could do it in home till I started talking to you. And so that is a huge benefit for these people that, especially with kids, like you said, they can do it every day and not have to worry about getting to the clinic at a scheduled time. And a family can even share it. We've even had a family share it among 3 different family members, one device. Oh, wow. That's incredible. I hope this message about neurofeedback gets out there more, because it is so great, like you said, for those with ADHD and anger issues and anxiety, depression, sleep issues. And so it's a great tool that people need to be aware of and use. And so thank you for spending time with us and teaching us so much about the brain, but thank you also for all that you are doing and letting others know about this whole holistic approach to brain health and using multiple tools to help the brain. I really appreciate that after dealing with depression myself and understanding that there's lots of root causes to it. And so thank you for everything that you're doing. And I always close my episodes by asking my guests what they have found to be the best ingredient in life. What would you say it is?
The best ingredient in life. Whew. Am I limited to one ingredient? First of all, I think life is the best ingredient in life, but the best ingredient, I would say love and passion. Passion for what you do, passion for friends and family. Find what it is that makes your heart sing and what you're good at and pursue that. For me, it's like, wild mushroom foraging. I never get tired of it. It's my exercise. It's my refuge. It's my adventure. I get to go on the hunt. It's my food. It's just the best for me. That's what really gets me super excited. Try different things, but I would say love, passion, sex, healthy relationships, reducing stress, lose the stress, find whatever it takes, get rid of that stress, and pleasure, joy.
Yes, all of those are amazing ingredients, definitely for a happy, healthy life. And so again, thank you so much for taking time to be here, and everybody go check out all that he provides. You learned a lot today. I know you have. And so go check out all the resources he has. And thank you again, Dr. Fellus, for being here.
Thank you so much for your podcast and inviting me and what you do to really educate the public. It's really terrific.
Thank you so much for listening. Remember to subscribe to the Just Ingredients podcast to learn more about your health and good ingredients to life. Plus, get daily tips at just.ingredients on Instagram.